Officials of the Philippine Health Insurance Corporation, or PhilHealth, have allegedly pocketed around 15 billion pesos from the agency.
Lumobo na naman ang utang. 762 million pesos, sabi ng Red Cross.
Favoritism, alokasyon ng pondo sa mga pasilidad na wala namang COVID patients at hindi maayos na liquidation.
Filipinos should expect to pay higher member contributions to the Philippine Health Insurance Corporation, or PhilHealth.
PhilHealth still has to pay the Philippine Red Cross more than 1 billion pesos in debt before COVID-19 testing can resume.
Habang dumarami ang bilang ng kaso ng COVID-19 sa Pilipinas, maraming Pilipino ang patuloy na pinagkakaitan ng sapat na tulong at ayuda para mapanatili ang kanilang kalusugan at hanap buhay sa gitna ng pandemya. Ang Philippine Health Insurance Corporation, na mas kilala bilang PhilHealth, ay isang government corporation na nasa ilalim ng Department of Health. Ayon sa Republic Act No. 7875, ang PhilHealth ay may mandatong mangasiwa ng National Health Insurance Program ng bansa, at alinsunod dito ay magbahagi ng health insurance coverage sa mga mamamayan upang tiyakin na abot kaya ang mga serbisyong pangkalusugan. Ngunit ang institusyong ito na dapat umaagapay sa mga Pilipino upang magkaroon ng access sa quality health ay nahaharap sa maraming issue at kontrobersya. Ito ang dahilan kung bakit napakaraming misinformasyon ang lumalaganap ukol sa PhilHealth sa iba't ibang aspeto ng social media. Ang salitang misinformasyon, ayon sa Merriam-Webster Dictionary, ay tumutukoy sa mali o hindi totoong impormasyon na kumakalat, intensyon man ito ng gumawa o hindi. Ngayong panahon ng pandemya, mas lalong tumindi ang paglaganap ng misinformasyon.
We're not just fighting an epidemic, we're fighting an infodemic.
Kaya't nais ng aming grupo na iwasto ang ilan sa mga ito na pumapatungkol sa PhilHealth sa pamamagitan ng pagbibigay ng mga detalyadong paliwanag at pagbabahagi ng karagdagang kaalaman na may layong mulatin ang mga Pilipino sa mga totoong isyung pangkalusugan at panlipunan. Kaya sa pamamagitan ng aming YouTube series na pinamagatang FAC-KER, the COVID-19 Fact-Checker with Group E of PS130 TFD, ating linawin ang ilang misinformasyon tungkol sa PhilHealth.
There is Annex A, list of medical case rates specifying how much PhilHealth pays for the treatment of a certain illness. There is also the Philippine National Formulary, or PNF, which, according to the Department of Health Administrative Order No. 34, Series of 2016, is a list of essential drugs in the Philippines prepared by the DOH. The PNF includes medicines that satisfy the priority healthcare needs of the population and are selected based on evidence of efficacy, safety, and relative cost-effectiveness. Now, according to Section 37 of Republic Act 7875, as amended by Republic Acts 9241 and 10606, the PNF is a reference list of medicines to be covered by PhilHealth. In its 8th edition published in 2017, the PNF did not include Remdesivir, which is an antiviral drug now widely used to treat COVID-19. The World Health Organization has also issued formal guidelines recommending against Remdesivir as treatment for COVID-19 patients, following the lack of evidence to support the claim that the drug significantly improves patient outcomes. Thus, Remdesivir is not included in the PNF nor covered by PhilHealth. A Twitter user mentioned @TeamPhilHealth in their tweet to ask whether or not Remdesivir was included in PhilHealth's COVID-19 benefit packages for inpatient care of critical patients. A PhilHealth officer from the hospital allegedly told them that Remdesivir is not covered by PhilHealth as it is classified as a non-PNF drug. It is true that some hospitals have not been deducting the cost of Remdesivir shots from medical bills and have instead been relying on out-of-pocket payments from the COVID patients, despite PhilHealth membership. But Remdesivir is, in fact, included in the COVID-19 benefit packages provided by PhilHealth. To understand how, let's look at PhilHealth's COVID-19 coverage system. When the COVID-19 virus first came to the Philippines, wala pang malinaw na guidelines ang PhilHealth sa handling at response dito. COVID-19 was a fairly new disease, so it was not yet charted in Annex A, List of Medical Rates, where all diseases covered by PhilHealth and their corresponding treatment costs can be found. Noong magsimulang lumobo ang COVID cases dito sa bansa, PhilHealth claimed through its Circular No. 11, Series of 2020, that it would provide financial risk protection to all COVID-positive health workers and patients. The specific guidelines in Section A of the said circular states, all Filipinos confined for COVID-19 from the period of February 1, 2020 to April 14, 2020 shall be deemed eligible for any of the benefits for inpatient care with no co-payment, whether in public or private facility. Filipinos who are not registered in PhilHealth shall be automatically covered, provided that they complete member registration prior to discharge from the facility. Ibig sabihin, sagot ng PhilHealth lahat ng bayarin ng mga pasyente sa ospital mula February 1 hanggang April 14 noong isang taon. Pero, paano ba nalalaman ng PhilHealth kung ano at magkano ang kailangan nilang bayaran during this period? Ayon sa isang doktor na aming nakapanayam, masusi ang evaluation ng PhilHealth sa mga dokumento ng COVID patients. Iniisa-isa nito para i-classify kung ano ang dapat nitong i-cover mula sa itemized billing ng pasyente galing mismo sa ospital. Hindi covered ng PhilHealth ang Remdesivir dahil hindi ito kasama sa PNF. Pero, tandaan nating para lang ito sa COVID cases noong February 1 hanggang April 14, 2020. Pagkatapos ng period na ito, nag-release ang PhilHealth ng panibagong guidelines through the PhilHealth Circular No. 9, Series of 2020, entitled Benefit Packages for Inpatient Care of Probable and Confirmed COVID-19 Developing Severe Illness or Outcomes. Nakasaad dito na unless ikaw ay isang health worker, hindi na fully covered ng PhilHealth ang expenses mo as COVID-positive patient. Instead, they would classify your condition under a certain COVID-19 benefit package listed in the PhilHealth Circular No. 9 Series of 2020. Under benefit availment in Section A, COVID-positive patients can claim 43,997 pesos for mild pneumonia, 143,267 pesos for moderate pneumonia, 333,519 pesos for severe pneumonia, and 786,384 pesos for critical pneumonia. Since benefits are already organized into packages, COVID-positive patients can avail them by their fixed rates. Halimbawa, si patient ay nagkaroon ng critical pneumonia. Ngayon, nagpa-confine siya sa isang tertiary hospital tulad ng PGH. As part of their treatment, binigyan siya ng ospital ng 10 doses of Remdesivir. Upon discharge, the costs of those Remdesivir shots will reflect in their hospital bill. Now, let's assume na 1.5 million pesos ang kailangan niyang bayaran. Once na mag-file siya ng claim sa PhilHealth, eligible siya sa benefits under the classification of critical pneumonia. Ibig sabihin nito, pasok man o hindi sa PhilHealth coverage ang medicines at facilities na ginamit niya, ibabawas na agad ng PhilHealth ang amount na 786,384 pesos mula sa 1.5 million pesos bilang package benefit. Dahil hindi na iniisa-isa ng PhilHealth ang item sa bill ni patient, automatic nang kasama sa provided amount ang costs ng Remdesivir. So yes, Remdesivir is included in the COVID-19 benefit packages provided by PhilHealth. While the Twitter user's post did not receive any likes, their question could have reached 3 other Twitter users as that was their follower count. Moreover, they tagged PhilHealth's Twitter account and their tweet could have easily come up in the search results upon searching the word PhilHealth. It's also possible that none of their followers nor the people reached by their tweet know PhilHealth's coverage on Remdesivir.